Hey there. What's the number one reason people come to a doctor? Well, it's to get well, right? But let's break this down just a little more. By the way, I'm Jason with Ocala Infectious Disease and Wound Center. We provide trustworthy collaborative results for your patients with simple to complex diseases and wounds to move you from no resolution or solution to a satisfied and well patient. I'd like for you to stick with me for just a few moments as I explain the Ocala Infectious Disease and Wound Center Wellness Model. And if you stick with me for these few minutes, towards the end, I'm going to reveal what happens if one doesn't follow our model. Sound good? All right, let's dive in. So whether you're a primary care physician, a urologist, a podiatrist, a vascular doctor, or you specialize in any other of these myriad of areas of medicine, there is going to be those patients that stretch your expertise. Those patients that at the heart, at the center, struggle to get well. And that is what we all want, isn't it? You, us, and especially the patient, we all want the end result of a well patient. What we've identified through working with thousands of patients and hundreds of referring physicians is this: achieving the status of a well patient is multifaceted. And here's what we mean by that. A well patient is comprised of faster results, trust plus confidence, and collaboration. So how do we do this? In order to achieve faster results, there has to be a proper diagnosis. And we have to set out to solve the diagnosis in a timely manner. That's why our team is trained to respond to referrals within the first 24 hours of you referring your patient to Ocala Infectious Disease and Wound Center. What we've also found is that being able to diagnose and solve a simple or complex disease or wound isn't actually good enough. We also have to prevent it. And this isn't just for chronic recurring issues. This is also for acute illnesses and wounds as well. You see, if we are able to solve and prevent, this builds trust plus confidence with the patient and with you, the referring doctor, which brings us to collaboration. The medical field is constantly changing, and even more so in the area of infectious disease and wounds, as fungi and viruses and bacteria, they're increasingly morphing and adapting at an accelerated pace, becoming resistant to common age-old treatments. So, by working in collaboration together, you and your patient, you and us and your patient, we're not only able to diagnose, but also prevent these ailments, resulting in a reduced number of occurrences. Now, a moment ago, I said that I was going to reveal what happens if we don't diagnose, if we don't solve, and we don't prevent. What ultimately happens is the patient doesn't get well, but there's more to it than that. You see, it's possible to diagnose and prevent. But if we miss solving, we end up with no solution. Likewise, we can solve and we can prevent, but if we solve and prevent for the wrong thing, we don't have the correct diagnosis, we end up with no resolution. And here's the kicker. We can diagnose and solve all that we want. But if we don't work together to prevent, there's no lasting solution. In other words, if we don't prevent, there's no satisfaction. So if you'd like help with your patients, if you'd like faster results, if you'd like to have trust plus confidence, if you'd like collaboration to help move you from no resolution to no solution and no satisfaction to a well patient. If you'd like to move from no resolution, no solution, and no satisfaction to a well patient, I want you to click the link below.